Hello, everyone. My name is Karen Murillo, and I would like to welcome you to today's CDC Partner Update call on COVID-19. This call serves as a way for CDC to share updates on COVID-19 and our latest resources and guidance, and to answer questions submitted by participants. Next slide, please. On today's call, we will share information and updates on mental health tools for state and local partners during COVID-19. First, we will hear from the Chief Editor for CDC's COVID-19 Science Update for the COVID-19 emergency response, who will describe where we are with the response and give us insight into recent scientific findings. Then we will hear from two experts on mental health tools relevant for use as we work through the ever-evolving COVID-19 pandemic. Afterwards, our speakers will answer questions we received over the last week via email. If you experience technical difficulties or otherwise would like to review today's call, you can find the recording on cdc.gov and YouTube in 8 to 10 days. All past partner calls can be found there, so please take time to review and share prior recordings. For more information about these webinars, visit our COVID-19 Partner Calls webpage, where you can register for future partner calls and see recordings of previous webinars. If this is your first webinar with us, welcome. Please see the link in the chat to subscribe and receive future call invitations. Please note, this call is not intended for media, although we welcome the media who may be here today. Should you be a reporter and have questions, we invite you to reach out to media@cdc.gov. These calls are designed to share the latest science, guidance, and resources from CDC. CDC has issued thousands of resources and guidance materials for individuals, businesses, and the public on our website, cdc.gov. Here are some highlights. We'll be providing links to these in the chat. First, the COVID Data Tracker Weekly Review. This webpage and newsletter highlights key data from CDC's COVID Data Tracker, narrative interpretation of the data, and visualizations from the week. As highlighted in the name, the review is updated weekly and summarizes important trends in the pandemic and brings together CDC data and reporting in centralized location. It represents the extensive data that CDC uses to track the pandemic on a daily basis. Specific information that can be found via the COVID Data Tracker Weekly Review includes state and territory data on variants, reported cases, testing, vaccinations, hospitalizations, and deaths. Second, on June 27, 2021, CDC released updated guidance on the need for urgently increasing COVID-19 vaccination coverage and a recommendation for everyone in areas of substantial or high transmission to wear a mask in public indoor places, even if they are fully vaccinated. CDC issued this new guidance due to several concerning developments and newly emerging data signals. First is a reversal in the downward trajectory of cases. In the days leading up to our guidance update, CDC saw a rapid and alarming rise in the COVID case and hospitalization rates around the country. Second, new data began to emerge that the Delta variant was more infectious and was leading to increased transmissibility when compared to other variants, even in vaccinated individuals. This includes recently published data from CDC and our public health partners, unpublished surveillance data that will be publicly available in the coming weeks, information included in CDC's updated science brief on COVID-19 vaccines and vaccination, and ongoing outbreak investigations linked to the Delta variant. Third, based on new evidence about the safety of the COVID-19 vaccines, CDC strengthened its recommendation for all people 12 years and older, including people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future. Currently, no evidence shows that any vaccines, including COVID-19 vaccines, cause fertility problems in women or men. There is no recommendation for routine pregnancy testing before receiving a COVID-19 vaccine. If you are trying to become pregnant or may want to become pregnant, you do not need to avoid receiving a COVID-19 vaccine. Those who are trying to become pregnant do not need to avoid pregnancy after COVID-19 vaccination. Now I'm going to turn it over to Dr. Midas for some general COVID-19 updates.
Thank you, Karen, and welcome to everyone joining us today. I'm Dr. Elissa Midas. As mentioned, I'm the Chief Editor for CDC's COVID-19 Science Update, a weekly series from the Office of the Chief Medical Officer for the COVID Response and the CDC Library that offers summaries of key scientific publications to inform public health professionals responding to COVID-19. Today, I'd like to provide a brief situational update and then review some of the latest scientific reports from CDC. Next slide, please. On this slide, you can see that COVID-19 cases, deaths, and vaccinations all increased this week. As of August 20th, the bottom line for the United States in red is that compared to last week, this week, the 7-day average number of cases increased by 12% to over 137,000 cases per day. And the 7-day average number of deaths increased by 23% to over 700 per day. Rising numbers suggest that in addition to increasing vaccinations, we need more community mitigation activities such as masks, physical distancing, and avoiding crowds in poorly ventilated indoor spaces to prevent or slow the spread of COVID-19. Also in green, over 362 million COVID-19 vaccine doses have been administered to 201 million people in the United States. Overall, 60.7% of Americans have received at least one vaccine dose, and 51.5% of Americans are fully vaccinated. Widespread vaccination is a critical tool to reduce the risk of hospitalization due to COVID-19. And we encourage you to visit CDC's data tracker for the latest COVID-19 statistics and key indicators from CDC. New this week, we'd like to share some of what we've been learning about vaccine effectiveness from 3 reports that were early releases in CDC's Morbidity and Mortality Weekly Report, or MMWR, on August 18th. And to read the full reports, you'll see the links in the chat, or please visit cdc.gov. First, I'd like to mention a report called Sustained Effectiveness of Pfizer-BioNTech and Moderna Vaccines Against COVID-19 Associated Hospitalizations Among Adults, from the IV Hospital Network in the United States in over 1,000 adult patients. Vaccine effectiveness against COVID-19 associated hospitalization was 86% during the first 2 to 12 weeks post-vaccination, and 84% during the following 12-week period. Vaccines were found to be 90% effective against COVID-19 associated hospitalizations for people without immunocompromising conditions. For people with immunocompromising conditions, vaccines were only 63% effective against hospitalizations associated with COVID-19 over the 24-week study. CDC now recommends that people whose immune systems are moderately to severely compromised should receive an additional dose of mRNA COVID-19 vaccine at least 4 weeks after their second dose for a total of 3 doses. Next, we have a report called New COVID-19 Cases and Hospitalizations Among Adults by Vaccination Status, which found that among adults in New York State, age-adjusted vaccine effectiveness against hospitalization was over 90%, but vaccine effectiveness against new SARS-CoV-2 infections declined from 92% to 80% during May to July. This decline in vaccine effectiveness against new infections coincides with the rapid increase in the Delta variant in the United States, along with relaxation of masking and physical distancing recommendations. Factors driving the apparent changes in vaccine effectiveness, including variations by age, were uncertain. An increased viral load of the Delta variant might underpin its increased transmissibility and could potentially lead to reduced vaccine-induced protection against infection. And finally, CDC released a report called Effectiveness of Pfizer-BioNTech and Moderna Vaccines in Preventing SARS-CoV-2 Infection Among Nursing Home Residents Before and After Widespread Circulation of the Delta Variant. Among nursing home residents in the pre-Delta period in March through May, 2 doses of mRNA vaccine were 75% effective against SARS-CoV-2 infections. But during the Delta period in June through July, mRNA vaccine effectiveness against infection declined to 53%. Investigators could not determine whether the lower vaccine effectiveness was caused by possible waning immunity, reduced protection against the Delta variant, or a combination of both factors. Vaccination of nursing home residents, as well as staff members and visitors, should be prioritized because residents remain at risk for COVID-19, and a potential need for another vaccine dose exists among populations at risk of severe COVID-19. And with that, it's now my pleasure to hand over the call to my esteemed colleague, CDC's Acting Principal Deputy Director, Dr. Deb Howry.
Thank you so much, and good afternoon, and thank you all for partnering with CDC to address COVID-19 and many of these associated issues with it in your communities. Today we're going to talk about mental health, and I think certainly many of us have lost loved ones and friends during this pandemic, some to COVID and some to other diseases or traumas. All of us have had to find sources of resilience as we deal with many kinds of stress, both at work and at home. And we know better now what we have really known all along, that physical health and mental health go hand in hand. COVID has really shown a light on this, especially for essential workers on the front lines of the pandemic and many of our partners such as you. In August of last year, we reported on a survey of the mental health of US adults during the first 6 months of the COVID pandemic. And what we found and reported on was that over 40% of respondents reported at least one adverse mental or behavioral health condition, including anxiety or depressive disorders, pandemic-related trauma or stress symptoms, and increased substance use to cope with stress or emotions related to COVID. We also reported that suicidal ideation was significantly higher in several groups, including younger adults, racial and ethnic minorities, unpaid caregivers, and essential workers. A follow-up MMWR in March corroborated these findings using data from the PULSE system, which is a collaboration between the CDC National Center for Health Statistics and the Census Bureau, and it tracks Americans' health over time. This report showed that over the second half year of the pandemic, the percentage of adults with symptoms of an anxiety or depressive disorder increased significantly, as did the percentage reporting that they needed but did not receive mental health counseling or therapy. And I also want to thank Dr. Midas and CDC COVID-19 Science Update. They alerted me to a pre-publication paper in Annals of Epidemiology, which looked at April and May data in Pulse and found that Blacks, Hispanics, adults with high school education or less, and those with an income less than $25,000, and renters, these groups disclose fair or poor mental health and depression symptoms. So this COVID pandemic really shows that we need resilience and the need for support from all of us. And again, many of these groups, some of the racial and ethnic disparities were really highlighted. The final MMWR that I just wanted to highlight came out in June, and this looked at an online survey of frontline workers, and approximately 25,000 respondents. Half reported symptoms of at least one mental health condition in the preceding 2 weeks, including depression, anxiety, and PTSD or suicidal ideation. And public health workers who reported being unable to take time off or who felt bullied, threatened, or harassed because of work were more likely to report adverse mental health symptoms. The severity of symptoms increased with increasing weekly work hours and percentage of work time dedicated to COVID-19 response activities. Since the beginning of the pandemic, and even before, CDC has been working on many fronts to support mental health. We have several data systems that we are able to provide data and snapshots of many different aspects. We have the Behavioral Risk Factor Surveillance System, which collects data on aspects such as mental health, wellness, and adverse childhood experiences. We have the National Syndromic Surveillance Platform, the BioSense program, which allows us to look at ER data in many conditions. I was co-author on a paper that looked at mental health visits to emergency departments during COVID. As mentioned earlier too, we also have the CDC pulse data, and this you can access on our website for weekly snapshots. And then finally, we have the National Violent Death Reporting System, which looks at medical examiner, coroner, law enforcement, and vital statistics data around suicide. CDC also has been working, next slide, on things like a suicide technical package, which really allows us to look at different strategies to prevent suicide, particularly at the community level. Things like strengthening access to and delivery of suicide care, promoting connectedness, teaching coping and problem-solving skills such as through social emotional learning in schools, and really lessening harms and preventing future risk. I've always thought this slide has been very helpful. It comes from a vital signs report we did in 2018, and this shows that often it's mental health in combination with other issues such as a relationship problem, substance use, job issues, as more than half the people who died by suicide in this report did not have a known mental health problem. It was many of these other issues that really impacted resiliency and why we need to focus on such a broad prevention when we're focusing on mental health and suicide prevention. Next slide. One of the programs I wanted to highlight that we've developed during COVID is called How Right Now. And this is a communications campaign designed to strengthen resilience and emotional well-being. And this online survey asks users to report how they are feeling at the moment, ranging from afraid, angry, grieving, lonely, sad, stressed, and worried. Next slide. These choices really validate and explain what people with each feeling may be experiencing and really offering things to do immediately, as well as linking to services. So somebody who's feeling stressed will get an explanation around the mental and physical experience of stress and note that it's normal during a crisis to feel it. And then the what to do ideas include relaxation techniques, advice to reach out to friends and family, and seeking support. And there's a link to the Mental Health America website on this. The other campaign that we have been involved in is the Be the One To campaign. And this campaign is really looking at how do you recognize signs of suicide and what to look for in friends, family members, colleagues, and how to intervene. Just to summarize, when I think about all the importance of partners and the work we do at CDC, I think there's truly a role to really focus on wellness, preventing mental health symptoms from occurring or from certainly increasing, and really having resiliency at both the individual and the community level. One of the ways we're doing this at CDC is by preventing adverse childhood experiences. And as I mentioned before, some of the suicide prevention work at the community level. I just wanted to end with two examples of some of the community resilience work we're doing from the Injury Center. One is strengthening families. One of our grantees in South Carolina focused on opioid use disorder and people at risk for it, brought together families through a virtual intervention during COVID to really use the Strengthening Families program so that families could talk about conflict management skills, life skills, and have those conversations to really build in that social emotional learning and those coping mechanisms. And the other example is a cooperative agreement between the Injury Center and the National Council for Behavioral Health that really looked at how we could identify and support novel, innovative, and emerging harm reduction strategies as a result of the COVID pandemic. I think we can use this pandemic to really look at new, innovative, and resilient strategies to help many different populations. So with that, I really want to thank you for all that you have done and what you continue to do.
Good afternoon, everyone. Today, I'll be talking about mental health resources for public health workers. So the United States has lost over 600,000 people throughout the COVID pandemic, with many more suffering the effects of illness, loss, and economic and educational disruption. The impact has been staggering, with lives lost, the pain suffered, and the strain across communities. All along the way, the U.S. public health workforce has been at the forefront, putting in incredible effort to protect the public for the last 18 months, working long hours, showing tremendous dedication and unwavering commitment as public servants during an unprecedented time. All of this while experiencing the effects of the pandemic themselves. As the pandemic ravaged the US, the strain on the US public health workforce became clear. Multiple news outlets featured stories about numerous public health workers resigning and getting fired. Many public health officials fell victim to doxing, where private information like home addresses were published to facilitate harassment. In August 2020, JAMA published a Viewpoint article titled Attacks on Public Health Officials During COVID-19 that described many of the traumatic experiences public health workers sustained while working to protect the public. The COVID-19 Health Department section within the state, tribal, local, and territorial task force developed a survey to quantify and describe the impact of COVID-19 on public health workers' mental health. Public health workers representing a non-probability-based convenience sample were invited to complete a self-administered online anonymous survey from March 29th through April 16th, 2021. Of the 26,174 public health workers who responded to the survey, 53% reported symptoms of at least one mental health condition in the previous 2 weeks. So in this case, either depression, anxiety, suicidal ideation, or post-traumatic stress disorder. 32% reported symptoms of depression, 30% reported symptoms of anxiety, 37% reported symptoms of post-traumatic stress disorder, and 8% reported suicidal thoughts. So given the public health workforce are under a lot of stress right now, what can we do to support them? During emergencies such as COVID-19, public health organizations can support workers' mental health by addressing work practices that contribute to stress and trauma, such as an inability to take time off, encouraging behavior changes that promote mental health, such as building awareness of symptoms of mental health conditions, and developing sustainable coping strategies, making employee assistance programs accessible and acceptable, and destigmatizing requests for mental health assistance. So the next couple of slides are going to focus on states that have developed resources for target populations, including public health workers. Early in the pandemic, Michigan developed their Stay Well program, which offered emotional support through a counseling line open 7 days a week, 24 hours a day. The program also includes a variety of other resources, including virtual support groups for target populations, crisis helplines, and mental health webinars. They have a summer resilience series ongoing through the end of August that has recorded webinars on meditation, mindfulness, nutritional habits, and expressive arts. Additionally, their behavioral health guides provide resources such as adjusting the emotional toll of COVID-19, supporting the emotional health of healthcare workers, and grief and loss in the context of COVID-19. Delaware's Department of Public Health website offers a list of hotlines and mental health resources. Additionally, the website also reminds people to have a mental health check-in. So take a breath of fresh air, take care of yourself by meditating, mindfulness activities, and exercising. Take regular breaks from the news and social media updates, and call or text a loved one, so just to reach out and connect with someone. The next set of resources I'll talk about comes from Washington State's Department of Health, Behavioral Health Resources and Recommendations. On their website, you can find Coping with COVID, a podcast which currently has 10 episodes where a psychiatrist and a disaster psychologist discuss the impact of COVID-19 pandemic on our well-being and what we can do about it. They also have a self-care resource section, which includes Washington Listens, where people can call and talk to someone about COVID-19 induced stress Monday through Sunday. Similar to Michigan and Delaware, Washington State's website contains a multitude of behavioral health resources for various target populations. For example, they provide a guidance document for building resilience in the workplace. This guidance covers the behavioral health impact in the workplace because of the COVID-19 pandemic, and tips and ideas for developing resilience at the organizational, leadership, and individual levels. According to the guidance, some tips to increase organizational resilience includes encouraging and supporting work-life balance, limiting work schedule to no more than 2 weeks without a break of at least 36 to 48 hours, rotating employees between high and low stress work or job tasks if possible, and encouraging the use of organizational employee assistance programs when available, as well as participation in outside support trainings or utilizing other resources. The last document I want to highlight from their list of resources is a guidance document for maintaining healthy incident management and emergency response teams during COVID-19. The guidance provides information on increasing both team and personal resilience during long-lasting disasters, in this case COVID, de-escalating team conflict, compassion fatigue, and burnout, and returning from response duty. This document is written primarily for incident management and response team leaders to help mitigate the behavioral health impacts of COVID-19 pandemic and to help uphold a resilient and sustainable workforce. And on the federal side of resources available, CDC mental health resources offer information on comprehensive evidence-based strategies, such as identifying and supporting people at risk, promoting connectedness, strengthening access, and delivering of care in CDC's technical package for both mental health promotion and suicide prevention in the workplace. The CDC has a dedicated page on mental health resources for public health and health professionals, which includes how you can recognize the symptoms of stress, such as feeling uncertain, nervous, or anxious, lacking motivation, or having trouble sleeping or concentrating. It also provides tips to cope and enhance your resilience, including the following tips. Communicate openly with your coworkers, supervisors, and employees about job stress, such as how the pandemic is affecting your work. Ask how you can access mental health resources in your workplace. Recognize that you are performing a crucial role in fighting this pandemic and that you are doing the best you can with the resources available. Engage in mindfulness techniques such as breathing exercises and meditation. Another federal agency that provides resources is the Substance Abuse and Mental Health Services Administration, commonly known as SAMHSA. SAMHSA provides outreach materials for crisis counseling assistance and training programs and other disaster behavioral health programs. Their outreach materials cover a range of information broken down by target population. Some of the materials relevant to public health workers include how to reduce stress regarding COVID-19 and information about coping with compassion fatigue and how to prevent and manage stress while on assignment. So in summary, there are a couple of things that we can do at the organizational individual level to help public health workers manage their mental health during COVID-19. Organizations can explore best practices and measures for staff support, such as reasonable workload, recognition of achievements, allowing time off, and employee assistance programs. On the individual level, public health workers can explore positive coping mechanisms and stress management, such as support from family, friends, and coworkers, meditation, exercise, or just going for walks in nature.
Thank you to Ms. Kone and all of our speakers for the informative presentations. For those of you who submitted questions in advance of this call, thank you. We received many excellent questions and we'll try to get to as many as we can today. Dr. Midas, if you could please answer the following questions. If vaccines are working to prevent COVID-19 deaths, why do we have to continue wearing masks even if we are fully vaccinated?
Thank you for that question. Given what we know about the infectiousness of the Delta variant and current vaccination coverage, layered prevention strategies such as wearing masks are needed to reduce transmission of this variant. At this time, as we build the level of vaccination coverage nationwide, we also must use all available prevention strategies, including masking indoors in public places to reduce transmission of the virus. Vaccines are playing a crucial role in preventing severe disease and deaths. And although vaccines are highly effective at that, they're not perfect at stopping all infections, and there will be vaccine breakthroughs. Millions of Americans are vaccinated. That number is growing, and this means that even if the risk of breakthrough infections is relatively low, there will still be thousands of fully vaccinated people who become infected and who are able to infect others, especially with the surging spread of the Delta variant. Low vaccination coverage in many communities is driving the current rapid and large surge in severe cases associated with the Delta variant. And more cases could also increase the chances that even more concerning variants could emerge.
Thank you. Understanding that vaccines provide the best protection against COVID-19, what should we expect moving forward in terms of vaccines and boosters?
Sure. The authorized COVID-19 vaccines continue to effectively reduce the risk of severe disease, hospitalization, and death, even from the highly prevalent Delta variant. But evidence is showing that over time, vaccines are providing less protection against infections or mild disease in certain populations. People who are at higher risk or who were vaccinated during earlier phases of vaccination rollout might need a booster dose to continue to have the maximum protection that vaccines provide. The government has developed a plan to begin offering booster shots this fall, subject to FDA conducting an independent evaluation and determination of the safety and effectiveness of a third dose of Pfizer and Moderna mRNA vaccines, and CDC's Advisory Committee on Immunization Practices, or ACIP, issuing recommendations regarding booster doses after a thorough public review of the evidence about risks and benefits. That said, we're prepared to offer booster shots for all Americans beginning the week of September 20th and starting 8 months after an individual's second dose. At that time, individuals who were fully vaccinated earliest in the vaccination rollout, including many healthcare providers, nursing home residents, and other seniors, could be eligible for a booster. And at that time, we would also begin efforts to deliver booster shots directly to residents of long-term care facilities, given the continued high risk that COVID-19 poses to them.
Okay. How do I talk to my friends and family members about getting vaccinated and about adhering to prevention strategies overall?
Yeah, those personal conversations are so important. I'd like to offer 5 ways you can help. So first, listen to their questions with empathy. COVID-19 vaccines are on the new side, and it's normal for people to have questions about them. The sheer amount of information and misinformation about COVID-19 vaccines can be overwhelming to anyone. You can help by listening without judgment and identifying the root cause of their concerns. Second, ask open-ended questions to explore their concerns. Open-ended questions are meant to elicit more than a yes or no answer. Asking open-ended questions can help you understand what your friend or family member is worried about, where they learned any troubling information, and what they've done to get answers to their questions. Third, ask permission to share information. Once you understand your friend or family member's question or concern, ask if you can provide some information and tell them where you get information you trust. If they agree, they'll be more willing to listen to you instead of feeling like you're pushing unwanted information on them. You can find answers to common questions from reputable sources, including cdc.gov, the local health department website, and other trusted sources such as their doctor, nurse, or pharmacist. Fourth, you can help them find their own reason to get vaccinated and to prevent the spread of COVID-19. Everyone who chooses to get vaccinated does it for a reason: to protect their family, to protect their children, to be less anxious, to visit their parents, or to get back to activities like seeing friends, resuming work, or returning to school. After addressing concerns with empathy and facts, you can steer the conversation from why not to the important reasons that matter to them, their why. The reasons that someone may choose to get vaccinated will always be those that are most compelling to them personally. And finally, help make their prevention strategies happen. Once someone decides on their why, help them make a commitment. Help make the path to vaccination shorter, easier, less stressful for them. Offer to help your family member or friend make a vaccination appointment. Help with transportation or figure out childcare if they need it. Remember, every person who chooses to get vaccinated brings us all a step closer to moving past the COVID-19 pandemic. And as a trusted messenger to your family and friends, you can play a role in their decision to get vaccinated and to stick to prevention strategies.
Thank you. Compared to previous strains of the virus, what are the data showing around the Delta variant in terms of prevalence of severe or serious illness and hospitalizations and transmissibility?
New data have been emerging that the Delta variant is more infectious and is leading to increased transmissibility when compared to other variants, even in vaccinated individuals. And this includes recently published data from CDC and our public health partners, unpublished surveillance data that will be publicly available in the coming weeks, information included in CDC's updated science brief on COVID-19 vaccines and vaccination, and ongoing outbreak investigations linked to the Delta variant. So Delta is currently the predominant strain of the SARS-CoV-2 virus in the United States. Delta variant is highly contagious, nearly twice as contagious as previous variants. And one reason for this is that the amount of virus it produces in the body is higher than the other variants. A higher amount of virus in the body means infected people are also shedding more virus and can infect more people. Some data suggest the Delta variant might cause more severe illness than previous strains in unvaccinated persons. In 2 different studies from Canada and Scotland, patients infected with the Delta variant were more likely to be hospitalized than patients infected with Alpha or the original virus strains. CDC is conducting surveillance through cohort studies for COVID-19 vaccine breakthrough infections, which can identify unusual patterns such as trends in age or sex, vaccines involved, underlying health conditions, or which of the variants are making people sick. Whereas breakthrough infections have generally produced lower viral loads, with Delta, the viral loads are about the same between vaccinated and unvaccinated adults.
And speaking about variants, can you provide any feedback on the Lambda variant? What is the Lambda variant and should the public be concerned?
CDC is aware of and is tracking the Lambda or C37 variant. Lambda was first detected in CDC surveillance samples in January 2021, but has never risen above 0.5% nationally. The proportion of Lambda peaked in July, has been continually declining since that time. The CDC will continue to monitor the Lambda variant, and if the proportion increases above 1% in any HHS region, it will be listed on the variant proportions page on the COVID data tracker website.
Thank you to Dr. Midas for answering these attendees' questions. Dr. Oury, if you could please answer the following questions. What actions can people that are feeling emotional distress related to COVID-19 take to help support themselves and others?
So for this, I would look at our How Right Now website. It gives some really practical tools on what you can do. And one, I think it's just to realize that it's normal to feel a bit of anxiety during a pandemic where we don't know always, how it's impacting our day-to-day functioning. It's important to remain connected to others during this time. That allows us to build that resiliency. And the website also has just some linkages to services as needed.
Thank you. With schools reopening for in-person learning and mental health being a growing problem among adolescents, what are some critical support and services we can provide as a community?
So that's a great question, and one of the things I would say is when we're talking about mental health, it's certainly important to focus on youth because we have seen some increased suicidal ideation. But as mentioned, during my remarks, we've also seen it in many other populations as well. So I always like to take a step back and just focus on what we can do at the community level around building resilience. For youth in itself, though, I think one of the things we've always seen that is helpful is having that caring adult, whether it be a teacher, a parent, a mentor, to provide connectedness, resources, ensure that they've got that safe, stable, nurturing relationship. And then I think just talking to youth about any anxiety or nervousness they might have about attending school. I have a school-age daughter, and I can tell you she had very little anxiety about going back to school and was delighted to return, but we talked about what to expect in advance. So I think just having those conversations, making sure that there's a caring adult who's there to provide those supports. And then again, if heightened concerns, I would look at our resources on our webpage for further services.
Thank you so much to Dr. Oury for answering those attendees' questions. Ms. Kone, if you could please answer the following questions. Fear and anxiety about a disease can lead to social stigma. How do we as public health leaders and community members reduce the stigma in our work and everyday lives?
Well, stigma hurts everyone by creating more fear or anger toward ordinary people instead of focusing on the disease that's causing the problem. Stigma can also make people more likely to hide symptoms or illness, keep them from seeking healthcare immediately, and prevent individuals from adopting healthy behaviors. This means that stigma can make it more difficult to control the spread of an outbreak. So, stigmatizing individuals may experience isolation, depression, anxiety, or public embarrassment. Stopping stigma is important to making all communities and community members safer and healthier. Community leaders and public health officials can help prevent stigma by maintaining the privacy and confidentiality of those seeking healthcare and those who may be part of any contact investigation. Quickly communicating the risks or lack of risks from contact with products, people, and places. Correcting negative language that can cause stigma by sharing accurate information about how the virus spreads. Speaking out against negative behaviors and statements, including those on social media. Making sure that images used in communications show diverse communities and do not reinforce stereotypes. Using media channels, including news media and social media, to speak out against stereotyping groups of people who experience stigma because of COVID-19. Thanking healthcare workers, responders, and others working on the front line. And finally, suggesting virtual resources for mental health or other social support services for people who have experienced stigma or discrimination.
Thank you. As the COVID-19 pandemic continues to evolve, guidance is changing and cases are increasing again. Do you have any tips on how to cope and enhance resilience in the workplace?
Yeah, so in addition to communicating about job stress, asking about mental health resources, and recognizing that you are performing a crucial role in fighting this pandemic is very useful or necessary. Also, talking openly about how the pandemic is affecting your work, identifying factors that cause stress, and work together with your coworkers to identify solutions. Remind yourself that everyone is in an unusual situation with limited resources right now. Increase your sense of control by keeping a constant daily routine when possible, ideally one that is similar to your schedule before the pandemic started. Try to get adequate sleep. Make time to eat healthy meals. Take breaks during your shift to rest, stretch, or check in with supportive colleagues, coworkers, friends, and family. When away from work, get exercise when you can. Spend times outdoors, either being physically active or just relaxing. Do things you enjoy doing during non-work hours. Take breaks from watching, reading, or listening to news stories, including social media. Hearing about the pandemic repeatedly can be upsetting and mentally exhausting, especially since you work with people directly affected by the virus. If you feel you may be misusing alcohol or other drugs, including prescriptions, ask for help. And if you are being treated for a mental health condition, continue with your treatment and talk to your provider if you experience new or worsening symptoms.
Thank you to Ms. Kone and to all of our presenters for answering our attendees' questions. Next slide, please. This concludes today's discussion. Thank you to everyone for joining our call today. A recording will be posted on our partner call webpage where you can find other recordings and information about previous webinars. Make sure to sign up for the upcoming partner call announcement to stay informed. The link is listed on the slide, or feel free to click or copy the link in the chat box. It's www.cdc.gov/coronavirus/2019-ncov/videos/partner-calls. Thanks again for attending, and a special thank you to those that have been attending all of these partner calls. We truly appreciate your commitment to getting the most up-to-date information from our CDC experts.